Hi, my name's Karen Samuels. I'm the Head of Health Technology Appraisal and Patient Access at the All Wales Therapeutics and Toxicology Centre, and that organisation provides a secretariat for the All Wales Medicine Strategy Group, which is the advisory body within Wales on access to medicines. After the difficulties really of assessing medical devices and technologies and the difficulties of measuring their benefit, the need to actually ensure that there's patient engagement, patient and public engagement, and also the measurement of outcomes of any introduction of such technologies would have, in order to ensure that any new technology or development is actually providing a benefit to the patients within NHS Wales. What ideally would be lovely to see is to see that we within NHS Wales are informed, so the choices that are made are from an informed perspective, and we know how much benefit any of these technologies are going to have, and then we can look back in retrospect and see that those decisions were very wise and have made stepwise improvements in patients' care. You know, if the report is the first step to that, then I think it'd be an excellent step forward. As AWTTC and AWMSG, we welcome the report and the recommendations within it, and we can see the need to have one voice to Welsh Government, really, and whether or not that is similar to what happens with NICE now, and that comes through AWMSG or an independent body. Obviously that will hopefully come out shortly, but the important thing is that there's a considered view and opinion given for the benefit really of the patients within NHS Wales. I think it's been a very comprehensive report, and we look forward to seeing further developments and the option appraisal that's contained in there.